Our moderator that the government had going from tip to tip on this island spoke about that this is a very emotional issue for our communities. And she's right. I'm sad. I'm angry. I'm frustrated. I'm tired. But I'm not so tired that there's no fight left in me. This is bigger than just a hospital. It's not just bricks and mortar. This is the lifeblood of our community. It's about the health and safety of our residents. It's about community sustainability. It's about attracting and keeping residents in our towns. It's about priority spending. It's about our aging population, building new manors with no extra beds. It's about our children and them having a community to come back to. It's about every islander from tip to tip. Ladies and gentlemen, we are not misinformed protesters, as Dr. Reid quoted. We are concerned citizens who care about our communities. I'd like to introduce Michelle Arsenault. She sits on our committee here in Alberton as well, and she's been instrumental in our advocacy for healthcare in West Prince. Thank you, ladies and gentlemen.
Thank you, Natasha. And I'd like to thank all of the members of the Island-wide Access Committee that have organized this event tonight. A few months ago, I got together with a group of concerned citizens in West Prince to try and see if we could come up with a solution to the ER closures at Western Hospital. We agreed to be nonpartisan. However, we knew that we would have to be political because healthcare in our province is run by the government. Despite our best efforts, those in charge of our healthcare would not meet with us privately. So here we are today to publicly tell those in charge of our healthcare, enough is enough. Our current system is broken, and government's plan for better access, better care, is like giving Tylenol for a brain tumor. It might dull the pain a little bit for a brief time, but it's not going to solve the real problem. In a statement made in January, the health minister said that healthcare was advancing. The definition of the word advancing from the dictionary is to move forward or to progress. Thousands of islanders without family doctors is not progress. My local hospital that 15 years ago could deliver babies, but now has a sign on the door saying in case of a medical emergency, call 911. That's not progress. In West Prince, going from 2 24/7 doctor-staffed ERs to 1 ER staffed only with a doctor during the day and with a nurse and possibly a paramedic at night, that is not progress. Depending on private fee-for-service companies as a critical component to our healthcare system is not progress. Shuffling our seniors out of their home communities and away from their families and their support systems is not progress. Another catchphrase that the health minister has recently been using is, our healthcare is evolving. To evolve, again from the dictionary, means to gradually change to a more highly developed form. I would argue that our healthcare is devolving. Right. Tommy Douglas fought for a Medicare system in which everyone was treated equally, regardless of their ability to pay or where they lived. We had that once, but not anymore. Shame. Shame. We are devolving into a two-tiered system of healthcare, one for the rich and one for the poor, one for urban islanders and one for rural islanders. Over these last few weeks of public meetings, we have heard officials blaming our healthcare woes on escalating costs, of not enough money to go around. However, Canada's leading healthcare economist, Robert Evans, has said that the wolf at the door of the Canadian Medicare system is not an economic wolf, but rather a political wolf dressed in phony economic clothing to deceive the sheep. Well, guess what? We aren't sheep, and we refuse to put our heads down and say ba ba. We are here today because we believe it is time for a fundamental change in the system of healthcare delivery in PEI, and the government's plan for better access, better care isn't it. Over the last 9 months, various groups from across PEI have been working independently, investigating the intricacies of our healthcare system. Recently, these groups came together to form the island-wide Hospital Access Group. It is astounding that these dedicated volunteers have somehow got a better knowledge of aspects of our healthcare system than the people who are employed to run it. Together, we have uncovered inexcusable levels of bureaucracy and mazes of finger-pointing. It's the seniors' fault. They're aging faster than we expected. It's the doctor's fault. They don't want to work long hours and they don't want to go to your rural communities. It's the federal government's fault. They don't give us enough in transfer payments. But never once have I heard any healthcare leaders stand up and say, we have made mistakes. We didn't plan well. We have come to the conclusion that healthcare for islanders is too important to be left up to government officials who are only concerned with their own 4-year term. Healthcare is too important to be run without consultation from frontline healthcare professionals. We need a nonpartisan elected health board which has equal representation from all counties, equal representation from both urban and rural areas. A health board like this should be made up of healthcare professionals, frontline professionals like nurses, doctors, paramedics, community members, and it must operate independently from government. No more should our healthcare be a toy for politicians to play with, robbing one community to gain votes in another, pitting one town against another. Shame. No more making promises to win an election and then breaking them as soon as you're in power. Healthcare needs to be delivered based upon best practices and quality care for all islanders. We the people here today demand that the government scrap its Better Access, Better Care plan, because clearly it will provide worse access and worse care. We demand fundamental change in how healthcare is run on PEI, not just window dressing. Stand up for the people you serve, Mr. Premier. Revolutionize healthcare for PEI for the better. Listen to the people who elected you. Listen to the people who provide healthcare on the front lines. Bring in an independent health board and let that be your legacy. Thank you.